Hi everyone, my name is Zelafy and I will be presenting about CT scan. So we're going to start with the history of CT scan. It started all in 1917 when Raiden he developed the basic mathematical equation, followed by Frank and Takahashi, who published the basic principle of axial CT, and Cormack, who developed theory of imagery construction in 1956, and then Hounsfield developed the clinical useful CT scanner in 1972, and a year later, the first clinical brain scanner is found in Mayo Clinic. So what is CT? CT stands for computerized tomography. It's used to take pictures of the body and uses computer to put them together. CT scan based on measurement of the amount of energy that a tissue absorbs as a beam of radiations passes through it from a source to a detector. I will be talking about 4 types of CT scan. The first type is the Electron Beam CT. It's a fast test to look for calcium buildup in the heart's arteries. It also uses an electron gun to scan the chest. This technique is inherently unable to capture dynamic events or movements that are quicker than rotation time. It may be used to screen people for coronary artery disease, and it can also help assess the risk of having a heart attack in the future. The second is the helical CT or the spiral CT. The X-ray machine scans the body in a spiral path. So the helical path results in a 3-dimensional data set and allows a scan to be performed in a single breath hold. The X-ray source attached to a freely rotating gantry, and the patient is moved through a rotating X-ray beam and detector test. The third type of CT scan is the Multislide CT scanner. They are now up to 8 times faster than conventional single-section helical CT scanners. These factors substantially increase the diagnostic accuracy of the examination. And its benefits is it increases the speed of volume coverage, which allows large volume to be scanned at the optimal time. The last one is the dual source CT. The dual source increased temporal resolution by reducing rotation angle required to acquire complete image. It uses a 2 X-ray unit, which makes it possible for the use of dual energy imaging. It also provides temporal resolution for approximately a quarter of the gantry rotation time, independent of the patient's heart rate, and without the need for multi-segment reconstruction techniques. Next, I'll be playing a video on how does a CT scan work.
CT scan is an X-ray procedure that creates cross-sectional images with the help of computer processing. CT images are more detailed than conventional X-ray images and can reveal bones as well as soft tissue and organs. A conventional X-ray uses a fixed tube that sends X-rays in only one direction, while a CT scanner uses a motorized X-ray source that shoots narrow beams of X-rays as it rotates around the patient. There are special digital X-ray detectors located directly opposite the X-ray source. As the X-ray passes through the patient, they are picked up by the detectors and transmitted to a computer. Image slices can either be displayed individually in 2-dimensional form or stacked together to generate a 3-dimensional image that can reveal abnormal structures or help the physician plan and monitor treatments.
So I hope this video gives you another idea of how the CT scan work. Now let's move on to the advantages and limitations. So we'll start with the advantages. They rapidly acquire images and provide clear and specific information. Image a small portion or all the body during the same examination. Also, speed, ease, and accuracy of a CT examination can reduce the risk of serious complications, and the ability to produce detailed image of bone, soft tissues, and blood vessel at the same time. For the limitations, it delivers high dose of radiation and it is expensive. It ranges from $1,400 to $2,500, and the scan of the head are slightly cheaper than those of the chest or abdomen. However, these prices can create a significant financial burden for patients, especially for those who undergo multiple CT examinations. And the last one is CT scanning of the abdomen may not be as sensitive in identifying gallstone as ultrasound of the abdomen. Typical effective radiation dose in adults range from about 2 millisievert for head CTs to about 8 to 10 millisieverts for CTs of the chest, abdomen, and or pelvis. These doses are high compared to those of natural background radiation, which is about 3 millisievert per year. The common problems of CT scanner is the first one is fail to detect cancer, lack of details, missed tumors, and inaccurate for treatment monitoring. As after cancer treatment, CT scan is unable to determine whether masses leftovers are cancerous or not. For purchase consideration, it covers an area instead of slices. Its rotation speed, patient volume, and cardiac CT considerations, and the image resolution is improving by time. So in conclusion, CT makes it possible to detect diseases at the early stages, and the radiation load is minimal. Some important advantages of CT scan are the possibilities of obtaining three-dimensional images of internal organs, the speed of conduct, and the comfort of the patient. That is it for my presentation on CT scan. Thank you so much for listening.